Hello and welcome to this week's episode of the Science or Fiction podcast, the podcast where we interview researchers to separate the science from the fiction in news headlines. I'm Dr. Kathryn Bates and I'm a youth development researcher at King's College London.
And I'm Afraa. I'm an assistant psychologist working in NHS diabetes services, and this is the Science or Fiction podcast.
So we're super excited to be co-hosting this special episode today. So far, Afra's been working behind the scenes as our young person consultant.
Yes, as our series is on youth mental health, I've been advising on how to make sure the content is relevant and informative for young people in all these previous episodes, and I'm looking forward to co-hosting today.
So in this special episode, we're not following the usual format. The question we're asking today is how can we learn about mental health? And we're interviewing a youth mental health clinical psychologist and researcher, Dr. Eleanor Chatburn.
Instead of discussing a specific topic in the news and going into one academic article in detail, we're going to be talking about how we can learn about mental health. There's so much information out there, from news articles on websites to infographics on Instagram and TikTok, and to people with lived experience sharing their stories and tips for mental health. So awareness of mental health has grown in recent years, but how we can support ourselves or each other is not always clear. Where we should look to about mental health and how we should approach it. So we hope through this discussion with Dr. Chatburn today, we get some answers.
So I'm super happy to welcome Dr. Eleanor Chatburn. Hi, Eleanor, how are you?
Hi, I'm really well, thanks. Thanks so much for having me.
Awesome, we're really happy that you're here. So can you just start by telling us a little bit about what you do?
Sure, so I'm a registered clinical psychologist, and I also work as a lecturer in clinical psychology at the University of East Anglia. So my job is basically working clinically with young people and teaching and lecturing the next generation of clinical psychologists, as well as carrying out my own research in mental health.
So it's really interesting that you're involved in both research and working in youth mental health services as a clinical psychologist. So we wanted to ask you how maybe your work as a researcher informs your work as a psychologist and vice versa.
Such a good question. For me, because I'm a clinical academic, I really want to use the insights that I learned from working with young people and parents to inform the research questions that I'm asking, but also vice versa, making sure that I'm using the latest research evidence and knowledge to translate to my clinical practice so that I'm offering the best possible care I can to young people.
Thank you. And maybe quite interested in hearing about what got you first interested in mental health.
Oh, I've been on a real unusual journey. I had a career change. I worked in publishing for many years, and I thought, you know what, I've just got to get out there and try something a bit different. And I did a second degree in psychology, and I worked a bit in research. And then I learned about clinical psychology, which I'd never even heard of before. And to be honest, I'm just a really curious, nosy kind of person. And what I like about psychology is you get to ask people lots of questions. And yeah, I just started training as a clinical psychologist. I'd never worked clinically with children or young people before. I had no idea if I'd be any good at it, but I did my first placement in CAMS and I just loved it. And yeah, been there ever since.
Thank you. So yeah, we wanted to start by talking specifically more about language surrounding mental health and the way that we talk about it in everyday life. So we know that some diagnoses can help people access support, such as being referred for therapy following a diagnosis of depression. So my first question is, where do common mental health symptoms and problems, such as anxiety or depression, become disorders, and how helpful is it to use these terms?
You know, I think this is actually such a good question. It's also a really big question. I'm going to do my best. So we've got ways of classifying mental health disorders, and there's two actually classification systems. One's called the Diagnostic Statistical Manual. It's currently in its 5th edition, and there's another system called the ICD. So we've got two different ways of classifying mental health disorders, and they do say slightly different things. So it's really confusing. But we've also got this wider issue of, well, actually, how helpful is it to classify mental health problems as psychiatric disorders, as medical disorders? And there's been a debate raging about this for many years. People have written whole books about how helpful it is to use these diagnostic terms. And I think, to be honest, a lot of the colleagues that I work with in children's mental health services would say sometimes they're helpful and sometimes they're not. It's a bit of a mixed picture. I think so. If you think about, all aspects of human experiences are on some kind of spectrum, and where we get into difficulty is when we think about what's quote unquote normal and what's quote unquote abnormal, because the culture and society you live in will, to some extent, set the parameters of what's normal or abnormal. So especially if you've got diagnostic systems that are based on, say, primarily Western models of health and mental health, and then you're applying them to different cultures, you've got lots of difficulties there. So we have these systems of classification that can help to understand when a problem has tipped over into what we might call a clinical range. So if a problem is causing clinical levels of impairment, it means that the symptoms or the presentation is really getting in the way of that person living their life, doing the things they want to do. It's maybe impacting their home life, their school life, study life, and it's also probably causing a lot of distress. So this is where we have lots of different measures and questionnaires and clinical interviews that can help to identify whether someone is experiencing clinical levels of distress. And then that's when you might think about whether a psychiatric diagnosis may or may not be appropriate. But because I'm a clinical psychologist, I'm not a psychiatrist. Psychiatrists are medically trained doctors who've done specialist study in mental health. As a clinical psychologist, I do use psychiatric diagnostic terms where I think it's appropriate, but I have other tools at my disposal. And one of the other ways of thinking about mental health, as opposed to just using diagnostic classifications, is this idea of psychological formulation. So a formulation is a way of understanding what's happened to a person and how they've got stuck, like with the current problems they have, how it's come about, and what's keeping that problem going. And it's an understanding that you come about in conjunction, in collaboration with a young person. It's not just a label, it's more of like a story of, okay, so if I've understood right, this is what's happened to you, but this is where you'd like to go, and let's think about how we can design treatments that can help to address these difficulties. So that's where we think about psychological formulation, but it can be sometimes that a diagnosis could be part of that picture. But personally, I'd always want to talk to a young person about whether that was a helpful diagnosis or not. Because, as I don't know if we'll come to touch on this, but we know that some diagnostic labels are particularly stigmatizing or carry negative stereotypes. But on the flip side, there can be some advantages for people understanding, actually what's going on for them. It is a known thing. Other people have gone through it. It's called this thing. And actually, it can help sometimes for people to access services and support where previously they might struggle without that diagnosis.
So it sounds like it can be a lot more kind of collaborative when you're kind of in this system, than maybe as simple as like you are maybe referred for mental health support, you are assessed, you get a diagnosis, and then you continue from there, because that's maybe what some people's perceptions are. But it's really interesting to hear that there's kind of different roles involved, like you said, psychiatrists, clinical psychologists, and also there's lots of discussions involved of like what's going to help you move forward.
Absolutely. I think in any ideal situation, I'd be wanting a young person to come in and have a really thorough assessment when they first make contact with a mental health service, so that they really get the chance to ask all their questions and to say, look, this is what's bothering me, this is what I'm distressed about, this is what I'd like help with, these are my goals. And then the professional to do a really thorough assessment, which will be asking all aspects of their mental health history, kind of context about their family, other things that are going on in their life. And then they might be thinking about doing some questionnaires just to make sure they're understanding all aspects of that person's experience. And then pulling that all together. It can be sometimes that there's a discussion about, okay, we think you fulfill criteria for this, psychiatric diagnoses, and you can have a discussion about that. It could be that you're seeing someone who's talking more in terms of formulation. So they'll listen to everything you've been saying, and then they'll kind of feed it back as a little story. So this is what I've understood. This is how I feel like you got stuck. And then based on that, then presenting options. So I'd always hope that a professional would be giving options to a young person. Based on everything you've told me and my understanding of your problem, this is what I'd be recommending as, the evidence-based treatment, whether that be medication from a psychiatrist, whether that be a talking therapy form of psychotherapy, like a CBT, cognitive behavioral therapy. There's many different forms of therapy. It could be a combination of the two. So giving the young person options, but helping them to understand what those options are and why that's being recommended.
Interesting. Okay, so can you be involved in kind of, as I'll call it, like more formal mental health support? So say being referred to CAMS, child and adolescent mental health services, and receive support, but not have a formal diagnosis as part of that. Like if it's not appropriate in your case, could that happen?
Yeah, really interesting question. So I would say in kind of years gone past, that would have been harder. I think people inevitably got given diagnosis as they moved through the system, and there was some bad practice where sometimes young people were not aware of the diagnostic labels they had been given until they saw their notes, and that's very poor practice. I think now we're in a better place. Sometimes just the nature, I think, of how the systems are set up and commissioned is, unfortunately, in some services, a diagnosis is still required. But what I would hope is that there would be context and explanation around that, because the difficulties with some of these diagnoses is they don't capture the full human experience. It's just a label, isn't it? And saying somebody has depression doesn't really tell you anything more about how the depression is affecting that particular young person at that time or what it means to them. And it also might not tell you anything about what else might be going on for them. So maybe they're also quite anxious, or they've also been recently bereaved, or they're being bullied. So that one label isn't going to capture all those other things. Sometimes we use the word comorbidities, which isn't I don't like that word, but it basically just means other things that might be going on, which actually, to be honest, is the norm, right, as humans. And we do know from the mental health research that conditions such as anxiety and depression are very highly comorbid, which means that people often have both going on. Sometimes it's what we might call primary or secondary. So primary means it's come first and it's driving the other difficulties. So say you're extremely socially anxious and you're not going to college, and therefore you're not kind of hanging out with your mates or kind of, staying in the house, then understandably, as a secondary effect, you may end up feeling quite depressed because you're not getting out much, and that's pretty grim for anybody. So then you can start off with an social anxiety disorder maybe, but actually that's also not capturing the effect on your mood and your self-esteem, and perhaps you're feeling lonely. Maybe it's also impacted on your diet, on your physical activities. All these different aspects of your life could be impacted. So this is why we kind of hold these diagnostic labels lightly, and we need to understand and talk to young people to really get, what their experience is and what matters to them.
Yes, so it sounds like quite a complex picture. So like, as you mentioned before, there's some cases or sometimes where a diagnosis is useful, potentially even giving someone, like helping someone understand what they're going through. But then there's other instances where potentially just a diagnosis of one thing is not enough. It doesn't capture the complexity of what they're going through. So yeah, it's really interesting to know that it can vary so much, and that's considered within these services as well and by the support teams.
Yeah, absolutely. And I think a really, a good team will embrace that, what we call multidisciplinary perspective, which is you might have your psychiatrist who may be helping with medication, you may have your psychologist who's helping you with therapy, you could be an occupational therapist who's helping you with kind of doing more of the hobbies and things you love. There could be a dietitian who's helping you to kind of ensure you're getting a more balanced nutritional intake, physiotherapist working on kind of increasing physical activity, so that everybody's working together, especially for those young people who are perhaps particularly struggling, that they might need that kind of team approach, and that there isn't necessarily just one kind of therapy. It kind of complements each other. But for other people, perhaps, they can just do one of those bits of the jigsaw, and it can be enough for them. They'll be like, you know what, I think I just need a little bit of something to get me back on track, and let me go away and try that now for myself for a few months. And then maybe people sometimes come back into the service after a few months or a few years to do another little piece of work. So it can be short-term, goal-based pieces of work that young people like to do. It doesn't necessarily have to be everything all at once.
That's really helpful. I was quite interested in what you said about psychological formulation. I feel like it's lesser known than something like diagnostic labels. So I was wondering, is this more of a personal approach to understanding the problems that a person might have, and how would you go about then communicating what you've gotten from a formulation to that person?
Yeah. That's such a good question. So formulation is, like I said, it's like a story. And what that means, it's unique to you as a person. That it's understanding how things came about. So what is it about your childhood, your early experiences, things that happened before that have led up to this point? Are there certain things that predisposed you to develop these difficulties? So that could be genetic predispositions. It could be something about your context where you grew up, vulnerability factors, but also what might have triggered it. So what was the more immediate things? So that could be like some very stressful event in the family, a bereavement, something horrible that happened to you, that kind of set off this put this train into motion. Then you have the presenting issue. So what's currently causing the difficulty, whether that's kind of feeling panicky, feeling very anxious, worrying a lot. Is it feeling very low, fatigued, tired? Is it feeling like you're worthless? Is it experiencing flashbacks, nightmares, whatever that is? And then thinking about, well, what could be going on that's keeping that problem going? This is what we talk about as the maintenance formulation. Thinking about other things that are going on kind of cognitively in terms of how you're thinking about the problem. We often talk about thinking about negative thoughts, negative beliefs, assuming the worst of situations, but also emotionally what's going on, and what's going on in the body physiologically. And then crucially, the last bit of the picture is behaviorally, so what you're doing or you're not doing. And then we've got these 4 elements. So we've got emotions, body, cognitions, and behaviors. They all mesh together. We often draw them out as a hot cross bun, like as a little cross, and we show how they all link together, and they can keep the problem going. When we draw that out, and sometimes psychologists, we are big fans, I have to say, of a little bit of a doodle, a little bit of a diagram. I have used whiteboards as well. Will help a young person see, okay, what do you think? Do you agree with that? And someone might say, no, you've got that completely wrong. Right, scratch it. We'll do that again, because we need this to make sense for you. And then when we've drawn it out and someone's like, yeah, I think you've broadly got that right, then we say, okay, so we've looked at how you've got stuck, where it's come from and how you've got stuck. Now let's look at how we can break this current cycle that's keeping you trapped. And then that's when we look into, okay, here are the options for the different treatments and therapies. So yeah, does that answer your question?
Yeah, definitely. Yeah, thank you. And I do have a follow-up. Yeah, you may have answered some parts of this question actually, but I'll go ahead anyway. So for someone who's trying to understand their own mental health, how can they make sense of different terms and symptoms that might overlap? For example, how does someone know whether they are experiencing anxiety just in a current situation or whether they have anxiety that needs to be treated as a condition?
I think that's so interesting. And like you say, I kind of like you're kind of hinting there that there are normal reasons to feel anxious. So say you've got exams coming up, and you're going through a really difficult time. You kind of want to be a little bit anxious. You need that activation. You need enough stress hormones to do your best. Because if you're not motivated enough, you might not do any study at all. But then, like you say, at what point does that become a problem? So if someone's like so anxious months in advance of their exam that actually they're barely functioning and they're not sleeping, and they're just feeling panicky, they're having panic attacks and they're not going out and seeing their friends, then yeah, things have kind of tipped over. And it sounds like, at that point, someone might be just so distressed and their anxiety, they've lost all control of the anxiety. So this is when I think you're thinking about really going to see a mental health professional who can do an individual assessment, because I think it's super hard for people to know, like, what's normal, right? Is this, and because I think inevitably you compare yourself to your friends and maybe your parents, and you're like, oh, but is this too much? Am I being too sensitive? So I would say if you can get to see a mental health professional, no question is too silly, and just go and get another opinion. I'm like, actually, what are your thoughts? And it can be quite helpful. There are also some questionnaires online that you can complete, which are ask questions about, say, I know we're talking about anxiety, but you can fill out some self-report questionnaires that can give you some feedback on, look, roughly this is your score. This indicates that you're roughly within the normal range, or it might say you're in the slightly elevated range, or it might say, no, your score is quite high. This is in the more severe end of the range. Go and have a chat with a professional.
I think, yeah, just what you said about being not knowing what's normal, especially when you experience it. We all experience distress, but it's hard to communicate that as well. Yeah.
Absolutely. And I think all the research in youth mental health is absolutely clear that the thing that matters most to young people is trusted relationships. And that is the number one thing. There are all these studies that have looked at why some young people don't feel comfortable in coming forward to ask for help when they think that they do have some mental health needs. And it comes down again and again to issues around stigma of mental health, or feeling embarrassed, or thinking people will judge them, the effects of stigma, and stereotypes, and worrying that people will kind of share confidential information. And really, the number one thing we have to do is build trust so that young people feel like they can trust the person they're talking to. And I think it's about thinking who you trust most in your life to have that initial conversation. Say, look, I'm finding this hard, and what do you think? Who do you think could help me? How could I get some support? Whether that is a parent or carer, an older sibling, a friend, whether that is your teacher or your college tutor or a school nurse, a GP, a social worker, or other youth worker. I think the key thing is to find someone you really trust and who's gonna listen to you. And then once you get that conversation started, honestly, I think just starting the conversation is the hardest bit for people. And as soon as you start talking, I think people often say, oh, I just have so much weight off my chest, just saying it out loud. I realize I'm not going crazy. And then, you know, someone will hopefully then help talk you through, okay, this is what I'm hearing. It sounds like, you know, this is what you're finding difficult. Let's now come up with some options for who might be the best person to talk to next to offer you some support.
So it sounds like as well, maybe it would be helpful for us to make it clear to the people around us, like when that they can approach us with like any issues that they're having. Because sometimes it's exactly that thing in Afra's question. It's really hard to put your finger on what it is. So even if you're not feeling like yourself or something's not right, it's hard to call it anxiety or depression or even be able to label it for yourself when you're struggling. So yeah, I really like that point to kind of ensure that our loved ones know that they can come to us and trust us, and we can maybe like find the words together, and that young people can then also find, you know, go to the people that they trust first and figure out step by step rather than like having to go straight in with like, I'm experiencing this. It's not that straightforward.
Yeah, absolutely. I think it's a process of finding a language for what you're going through, and that's okay to give that time. And this is why I think, like you started off with, Afra, talking about kind of social media and all the stuff we see online, that there's pros and cons of that, because it can give us preconceptions of, well, this must be what anxiety problems look like or depression looks like. And that's not the case, because we're just seeing one content creator's own personal experience or whatever it is. So I think you're absolutely right, Kathryn, that just having that conversation and kind of almost going back to the basics of, you know, tell me what's actually happening for you and what this means for you. Put aside preconceptions, because a lot of, take depression, for example, we might have a picture in our head of what we think depression looks like based on, you know, the pictures you see in the media or film, someone with their head in their hands. And actually, in young people, depression can look more like irritability, fatigue. It might not look like what we see as adult depression. So this is why it's really important that you find someone you could trust just to talk to them about everything that's going on for you. Not just telling them about the bits that you think they might want to hear or that you think might fit in with, you know, a certain difficulty.
There's so much mental health information now out there in different formats. So we often see mental health talked about in the news, including like policy changes and commentaries on what's going on in the public. Mental health researchers tend to use Twitter to talk about their research, but now also there's like millions of videos on different social media channels, TikTok, Instagram, YouTube. And this is from all different perspectives. So people with lived experience of mental health issues, but also researchers and charities, and even brands and influencers, which you kind of mentioned as well. So amongst this sea of information and different perspectives, how can we navigate learning about mental health when there's just so much information out there?
I think this is a unique challenge that younger people are going through, that, I mean, I didn't have to go through when I was an adolescent. How do you pass this information? How do you assess the quality? How do you work out the vested interests behind this content, right? Because nobody's truly neutral. Everybody's pushing some agenda, whether it's raising awareness of their charity and the support they offer, whether it's trying to sell your product, whether it's trying to generate some controversy to build up, you know, followers. I think it's a uniquely difficult situation, but we have to balance that with, it's also a unique potential for sharing mental health information where previously it was harder to access. And I do research looking into, you know, mental health information on social media. It's something that really interests me, and I try and take a balanced approach, because I think colleagues of mine are overly critical and alarmist they're very concerned about the information that's on sites like TikTok, because they don't see it as any real force for good, and they think it's, potentially outright dangerous. I try and think about, well, let's also think about how we can help young people to access the higher quality and more reliable information that is out there. And I think there's, as you said, there's different types of information, and it depends very much, I think, on what young people are looking for. I think there's, and I think we shouldn't make assumptions what they're looking for as well. As a mental health professional, sometimes I think, well, maybe more of us should create TikTok accounts. And a couple of people have, like Dr. Julie Smith, who's a fabulous clinical psychologist. But maybe sometimes actually young people want to hear from others with lived experience, and that kind of more peer-to-peer content is actually what they want to hear. So I think you have to think about, firstly, what is it you're looking for, but then also how do you appraise the quality and reliability of that content? Because we've got some research papers that are coming out now. For example, I read one just the other day about ADHD, which you'll probably know is one of the most highly viewed hashtags on TikTok. Extremely high rates of misinformation about ADHD are currently all over TikTok. So it's really hard to appraise the reliability of that information. And also it's hard to know who has produced it, because sometimes people don't state whether they are a professional, and if so, what type of professional. Are they talking from personal experience? Are they just an influencer who's just making content? Who is this person? What agenda are they pushing? What are the sources of citations for that information? We know that the algorithm pushes people down a certain track, and it tends to push more controversial, emotive information at people that tends to elicit more likes and shares. And this is the issue I do have, is that it is hard as a professional to create content that's nuanced because the algorithm doesn't like nuance. It wants controversy and big, bold statements. It doesn't want someone like me going, well, it's a bit of this and it's a bit of that and it's complicated. Go and read this more detailed long article or watch this longer video. So this is the problem we do have, I think. So I think what you can do when you're kind of scrolling through your For You page is just be mindful of what the algorithm is choosing to show you, and that it's only one part of the picture, and that it's not funneling you into just going down one route, giving you one type of content that might mean you're missing out on thinking about the bigger picture. So like we were talking about the fact that often, say, anxiety and depression go together, for example. Say you started off looking at anxiety content, it could very quickly funnel you towards some quite specific anxiety stuff and actually take you away from thinking about, actually, maybe there's a couple of things going on, and it would be helpful to also check out some stuff on low mood, for example. So I think being savvy about the algorithm and trying to curate your feed as best you can, choosing very carefully who you follow, who you engage with, muting any unhelpful or risky or triggering content, and taking lots of social media breaks. And I think trying to seek out other views and perspectives is just helpful for building a balanced picture.
It sounds like there's potentially some positives, like the fact that we get to kind of see people's lived experience of mental health, for example, which potentially wouldn't really have been available before, and more easily access this information that like clinical psychologists and researchers, for example, are putting out there. As much if that can be condensed into a 1-minute video, that's more accessible to more people than a 10-page academic journal article. But also just being aware of the dangers. And that's something that I hadn't really thought about before, how the algorithm's not just about like pushing stuff to you that you're going to buy or like different brands. It's actually like orchestrating all the content that you look at, including mental health information. Yeah, so that's really useful to know, like just to be aware of what you're looking at and how many videos in the space of like 5 minutes have you been shown that are talking about anxiety in a negative way or something like that. I think that's really helpful to know.
And also being aware of how powerful the content you consume is in constructing the way you see yourself and your needs or problems or difficulties. And we can very quickly get, like I said, sent down a certain funnel towards, oh, well, it must be anxiety, it must be PTSD, it must be this, it must be that. And then it kind of inevitably feeds into then how we maybe talk about ourselves, the content we might create ourselves. So I'll see a lot of people making content saying, they say, my anxiety, talking as in the language of kind of using like these kind of medical terms, diagnostic terms even, when they haven't seen a professional, they haven't had that individual assessment that we talked about that's so important, and they haven't had that discussion about, okay, is a diagnosis helpful or not? They haven't had that collaborative psychological formulation. So I think there's some controversy over this idea of self-diagnosis that I see a lot on TikTok, especially in the sort of ADHD space. I know there's lots of discussion going on about that at the moment. And I just want people just to hold all these ideas lightly, because I am seeing some young people who sort of turn up in clinics saying, I think I've got ADHD, autism, whatever it is. And then it can be quite a tricky discussion to have with someone if they're really set on that and they haven't yet had that really thorough assessment, where it could be, in order to do this assessment, we have to rule out a number of other things that could possibly explain this presentation, and that's a thorough process we have to go through. And there's other explanations for maybe the symptoms or the difficulties you're experiencing, and different disorders and conditions can overlap. It could be that there's quite a few things going on and we need to unpick this. So this is why I think great if it helps someone to think about what's going on for them, and it might point them towards some resources, and it might point them towards, yeah, okay, I'm going to go get an assessment. But do hold all these ideas and preconceptions lightly, and just be open to, like I say, doing that really thorough mental health assessment with a professional who can then help you best understand what's going on for you.
I'm also quite aware that we're having this conversation in like amidst very long waiting lists for referrals for like formal mental health support. So I wonder if there's anything you recommend for young people that are trying to like understand more about how they feel, but are either waiting or waiting to get that formal support. Is there talking to charities an option? What are your thoughts on that?
Yeah, it's such an important question because, like you say, Kathryn, and unfortunately we're in such stretched times with government funding for CAMHS services at the moment, and adult mental health services as well for those over 18. These services were already struggling before the pandemic, and it's a really tough time, and I think we shouldn't take away from that. There are some people sitting on waiting lists for 1-2 years waiting for help. So I'm really keen that we do talk more about the support that's available outside of the NHS. Fantastic charity sector and the amazing work that goes on within local communities. And there are now some really great websites where people can go and put in your postcode. So one's called Youth Access, but also on the Mind website or the Mix, you can put in your postcode and it'll tell you all the services that are available in your local area, whether that's kind of mental health related, maybe it's substance misuse related, sexual health related, you name it. And a lot of those charities, you can just directly self-refer, or they'll run like a drop-in centre. Also, we've got a lot of fantastic youth support online services where there are, instant messaging, email support, telephone support. So I really recommend Young Minds as a fantastic one-stop shop for signposting you to all of these great resources. And it could be that some people actually, maybe they don't need to see a mental health professional. They will get the help they want from their local community, from youth groups, a religious leader, through their school or college, and that's fine. And that's the help that they'd like. Others, they could be that they do want to make sure they're on a waiting list for mental health support. But there are things that you can be doing in the meantime. Maybe if you are on a waiting list. And I would say do check out, support that's available. There's another company called Kooth that offers free counselling depending on the region you're in. So there are these kind of briefer, time limited kind of counselling and therapy support you can get as well.
Thank you, Eleanor. As there are a lot of different reasons we might look for information about mental health, and you've given some recommendations if you need mental health support, and I'm assuming that would be if you wanted to support a loved one as well, this could be access these links to these charities people can go to. So if someone is just curious to learn more about mental health and this apart from just wanting to be supported for their own mental health, how can they go about that, and where can they access this kind of information?
Yeah, good question. I think the good news is there's a lot of stuff out there, like we've been talking about. It's about finding something that's reliable, and that who's producing it. And so I would say look for reputable charities and organisations. So look for kind of mental health trusts, look for registered charities. So like I've said, Young Minds, Mind, Youth Access, the Samaritans, Beat for eating disorders. But also I would recommend following mental health professionals who are active on social media. So I'm just going to put a shout out for Dr. Julie Smith, who has, I think, well over 1 million followers on TikTok, if not many more. And she's written a great book. I've written down the title here. It's called Why Has Nobody Told Me This Before? And that kind of book I really like, because it's a sort of almost like the things you were too embarrassed to ask about mental health. Little sort of things that you can do for yourself at home, strategies, tools, techniques, self-help things that you can try for yourself or for a loved one or a friend. So there are some great self-help materials out there online, and also there's a fantastic series of books called the Overcoming series. So they got titles like Overcoming Panic, Overcoming Social Anxiety, Depression, Low Self-Esteem. They're written by licensed, fully registered clinical psychologists and CBT therapists, and they're based on all the evidence base that we know for those different conditions and what helps. And there's some online materials that go with that. So I think there's a lot out there. It's just like you say, it's about finding the right and something that suits you, something that speaks to you and that's accessible. But hopefully there are some helpful suggestions there to get you started.
Thank you. Yeah.
It's actually really helpful to just pinpoint some specific ones that potentially haven't heard of, because it's the kind of thing you Google and there's just so many things come up, but also nothing at all. So it's really true. Nice to have some actual searchable names and stuff, and we'll put all the links kind of in the episode information as well, so that people can follow up.
I found it interesting about looking into engagement of when young people will come to mental health professionals, and if it's about trust and someone that listens, it tells you those are quite fundamental things, and we might get bogged down in more of the oh, but it's about how much this psychologist knows about a certain condition, but maybe it's a bit different, and it's more about relationships. That's what I'm looking at.
I think you've put your finger on it there, and I know there was a researcher who calls it the ordinary magic. Okay, it's that, like you say, it's not overcomplicating it. It's that ordinary, everyday thing that makes the difference. And for young people, because one of the key things about what we call the period of adolescence is transferring from a child when you're reliant on others for your well-being to ultimately becoming an adult where you're self-reliant, and that is a key developmental task, as well as physically, hormonally, all the changes that you go through. The brain continues to develop actually up to the age of 25, so adolescence goes up to the age of around 25, is learning to become autonomous and self-reliant, and learning to trust others around you is absolutely key, and relationships are fundamental. And this is why in youth mental health, we really, really need to prioritise getting the basics right, building those trusting relationships, almost like a network around young people, and also building those the communities that are kind of whole community-based approaches as well. So it's not just about working with one young person in isolation. You know, maybe sometimes we need to work with a whole family or whole community so that young people feel supported. So it's almost like a sort of it's like multiple systems really nested. The young person's at the center, but we need to have different layers of intervention and support with a young person at the middle. But sometimes maybe the work isn't with the young person, it's with the wider system.
I think that's a really good point, that it's not always the young person that needs to like change their behavior, but it's actually the systems around young people, like community, and also like the way that the expectations we have of young people who are still in this like really developmentally important stage, where we shouldn't expect them to take on all this responsibility or be able to like perfectly articulate exactly how their mental health state is. And actually it's about us learning, or everyone around them learning, as well as the person themselves.
I think that's really well said. I think the adults around a young person have a duty to understand what's going on for that young person, and to also understand what adolescence is, what it means. Like you said, the changes that young person is going through physically, you know, psychologically, socially, and not expecting, you know, adult levels of emotional kind of insights and strategies, behavioral strategies, self-management strategies that take adults many, many years to learn through trial and error, and usually getting it wrong and then learning. And I think we're treating now a lot of our teens as adults, which there's advantages to that, right? We want to give autonomy and freedom, but we shouldn't be putting extra pressure to suddenly like magically have learned all these like coping strategies and problem solving tools and techniques that take years of practice and trial and error. So yeah, I think for sure, you know, we have a duty as adults to do that work and to develop that kind of psychological mindedness of what might be going on for this person, and to take a developmental approach. So bearing in mind that, you know, at different stages of development, a person will be at different points, and we've got to meet them where they're at on their own unique journey.
So it really reminds me of working in diabetes. So we're looking at physical health and mental health, and there's a lot of expectations that any kind of long-term health condition, chronic health condition, and the kind of expectations it puts on young people especially can just be overbearing. And it's really, it's really good to just hear that, you know, we do sometimes expect a lot from young people, and that's a lot from the physical health side, but there's also mental health as well. So and when there's those two burdens, we see a lot of problems and misunderstandings as well.
Absolutely. I think sometimes the problems are arising because the parents' or family's expectations are not in line with, the young person, how they view things and their experiences. And certainly I've worked with, individuals where really the work has been more around helping the parent to manage their own anxiety and concern. When a young person's going through what we might say is more kind of developmentally normal process of, all the things you do, where you're kind of rebelling and testing boundaries and making mistakes and testing things out. Some, parents and families find that understandably quite hard, but it's more for them to work with, managing those feelings, and having kind of two-way communication with the young person, so that they're having open dialogue. So that's why sometimes it's more of a kind of family-based sort of approach that can be helpful.
It's been really interesting to hear from Eleanor, and as someone who's in the clinical psychology space, I feel like I'm still learning. Even before I've been studying psychology before working as a practitioner, and I had some maybe preconceptions, and I thought maybe psychologists were the ones that were diagnosing, and then I saw it as a very structured way of dealing with mental health problems. And through my own experiences of working in the last few months and also speaking with other professionals and qualified clinical psychologists, it's more of a complicated picture. And it's good to hear that it's like there's something like a label or a diagnosis isn't redundant. It can be helpful in certain circumstances. And I think the bottom line is making those people that we're working with, they can be young people, any person, making them aware of how maybe a label can, how they find it, and how it could be empowering to just have those discussions and build that trust. So I'm glad we got to talk about how important it is to have a trusting and good relationship when you're working with people, especially being a professional and acknowledging that you have more power in certain circumstances. So yeah, that's been really helpful, and hearing about having thorough assessments from a mental health professional, and that being something that you suggest that young people do if they find themselves that they're in a lot of distress. But yeah, that was good to hear. But yeah, I'm also, like both of you, thinking, a bit overwhelmed by how much information there is out there. And those links and charities that you suggested, and the names of those influencers, because they are out there, and it's good to just name people that we're like, this person's out there, they're qualified, or they're saying that they're bringing their experiences into the conversation. It's good to mention those names. Been very happy to have this discussion. Really insightful from you, Eleanor, as well.
Thanks. Oh, just really interesting to hear what you took from it. Brilliant.
Yeah, thank you both. It was a really useful discussion. Like I really learned a lot as well. And like Afraa said, I think it's really nice to pull out all those things that maybe hadn't occurred to us before, like building relationships, starting from just having a very simple conversation with someone you trust, and obviously the concrete suggestions of different people to contact or different charities to turn to is also really helpful.
I think we could have talked about this all day, but hopefully it's been a bit of a useful taster.
Oh, and thank you, Kathryn, for letting me co-host. Sorry, around. Out from behind the scenes.
Of course, absolute pleasure. Thank you so much to Dr. Eleanor Chatburn for coming on to the podcast today, and to Afraa for co-hosting this episode with me. You can follow us for updates and more information on Instagram and TikTok at Science or Fiction Pod and on Twitter at Sci or Fiction Pod. If you want to get in touch or if you have a suggestion for a future topic, you can message us on social media or email us at info@scienceorfiction.co.uk. And as always, you can find recommendations from today and links to mental health support at www.scienceorfiction.co.uk. Thank you again to Afraa for helping to produce and co-host this episode. Thank you to Kit Studio for the branding and to Jamie Johnson for the music. See you next time.